everybody, to the Global Positive Health Institute podcast series. My name is Dr. Liana Lianov, the president of the Global Positive Health Institute, and I'm delighted to have with us today Dr. Dexter Shurney, who's been a longtime colleague and friend in the lifestyle medicine community, and he is currently the Chief Health Equity, Diversity, and Inclusion Officer for Adventist Health and the president of Blue Zones Wellbeing Institute. So welcome, Dexter.
Thanks for having me, Liana. It's great to be here.
Thank you. And on this show podcast, we talk about all things related to happiness and health, positive psychology, lifestyle medicine, how they interrelate to really promote well-being and what I call positive health, being the best that we can be. And so we'll just dive right in, and I'd love to hear what first grabbed your attention to this whole area.
Well, I tell you again, thanks for having me. What really grabbed my attention is I became an N of one. You know, I was my own experiment and took on some of the things that we talk about in lifestyle medicine, made lifestyle changes in my life. And I was just amazed with how fast my body responded and how well my body responded. And ever since then, I've learned more and more and become even a stronger, firmer believer in the whole area of lifestyle medicine. So it's been a great journey, and I'm healthier for it, happier for it, and hopefully others that are on this journey with me are also healthier and happier, including family members.
Wonderful. And of course, Healthy Lifestyles has many components and pillars. And one area that we particularly focus on here is the social connection, the positive psychology, positive interactions, the positive emotions that boost these healthy behaviors. So tell us a little bit more about how you see that fitting in to healthy lifestyles.
Yeah, well, I see it's part and parcel. One of the things is, you know, I've spent a lot of my time doing employer programs, and usually they come under the title of wellness programs, but it's in some ways it's similar to lifestyle medicine in that it's really hard to motivate an individual to adopt a healthy lifestyle if they don't have some positivity in their life. And so the two go hand in hand. So what I used to do when I would run these large employer programs is I would try to marry our mental health, our psychology programs, you know, directed towards depression and anxiety alongside of my lifestyle programs, because I want to make sure that, you know, it's really hard to get somebody to eat well or to exercise if they're depressed, you know, so just the opposite, negative psychology. And so, you know, how do you use that in some ways, even as a filter, to know when to engage and when you can get people over certain thresholds. And so what you're doing with positive psychology, I mean, that's really part and parcel of that. In my mind, this is how we motivate people to want to do better. And you can't do, you know, true lifestyle medicine without it, is my belief.
Well, you've echoed what I've been passionate about. It is the foundation of lifestyle medicine, and we can't move forward without it. And it also really adds additional protective factors. At least the early science is showing that way, which is very exciting as well. So, of course, we've been a proponent of figuring out how we can harness the science so far and then translate it into lifestyle medicine practices and other healthcare fields. So what is your potential, how do you potentially see this moving forward? What's the vision for the future in this field of lifestyle medicine sort of expanded to help with positive health?
Well, you know, again, I've spent most of my time on the corporate side with benefit designs. And so in my mind, it all comes back to reimbursement and how you package things up to reimburse. And so I think the most powerful programs will be at the intersection of positive psychology and lifestyle medicine. And then how do you pay for that, right? And ideally, you don't want to have those things separated. You don't want to have the positive psychology person over here billing their CPT codes, the physician over here. So in my mind, I think the future looks at bundled payments.
Mm-hmm.
I think the future looks at centers of excellence around these kinds of concepts to truly move the needle and have people that understand how to really bring these things together and bring them together so that you get the best optimal outcomes. Not just bringing it together so that somebody can do positive psychology and bill a CPT code, and then they're fragmented from the person that's doing something else over here, and then they bill for that. The two don't come together, and you really lose a lot of the value. Again, if you're really chasing a CPT code and that's all that your mind is on, you start to lose the fact, are you really making progress and making the patient better? I mean, that's great, and hopefully you are, but you're really like, can I bill my RD for this? Can I bill my psychologist for this? And that becomes your frame. And so I'm looking at these broader reimbursement approaches that brings the incentives together, brings the outcomes to the fore, because we really truly have better outcomes, or can have better outcomes if we do this in the right way. It's not with 10-minute visits, as you know.
Yeah, you basically described what we're now calling whole person health and holistic health. And you really have to have all the pieces together, offered to the patient together and reimbursed together. And then all the resources that are needed, because it takes a team to make that happen, are then more readily available. And that's certainly what we've been struggling with in the lifestyle medicine community, and appreciate your leadership and other leaders to moving that forward. And yeah, where there's the role for positive psychology and positive health is to be a seat at that table of what it takes to really offer high quality, again, whole person centered care.
Yeah, and I think the other thing that, and again, my frame of reference is more on the employer side,
Yeah.
which is good in a way, because in ERISA self-funded programs, each of these organizations can design their own benefits package. And so they're much more agile than CMS. Mm-hmm. And obviously, as an employer, what they're really looking for is, how do they have a happy workforce, a happy, healthy workforce? And so what positive psychology does is that we can now broaden the value proposition. Because if you think about employers, particularly now, in this age of quiet quitting or the great resignation, a lot of the things we're talking about here with positive psychology can help them with retention and engagement. It can help them with concepts of isolation and loneliness. And so we have a much broader value proposition. And so instead of being only valued on, did we control A1C this month? What did we do for retention? Which has a staggering cost to have to replace people because they're, don't show up to work. Mm-hmm. When I was at Cummins, one of the plants that we had several plants across the country, but one of the plants that I was working with most closely in Indiana, we would have a float crew of 21 people that were always on call for that plant, and they would come in and they would get paid. 21 individuals. And they were there just because we knew on average about 21 people would call in sick. And so that was just an added cost. And so one of the ways I got that manager engaged was to say, what if I get your float cost down from 21 employees to 19? That's real money. Every day, paying for 2 less people to come in, that's real money. Mm-hmm. And so I think this whole positive psychology can show benefit there. And now if these folks are paying for this, there's even more reason for them to want to. It's not just the standard things that we look at in CMS, check the HEDIS stuff. That's fine, but that's not going to get these people. We have more to offer some of these other payers.
Yeah, you're absolutely right that employer groups have been front runners in healthy lifestyles and really caring about the outcomes, because that does, as you say, affect their bottom dollar. And so they have the agility to be creative and sit back and say, well, what do we put together to get those results that we're looking for, as opposed to being tied to old policies and regulations and payment systems that are completely removed from really thinking about that ultimate outcome.
That's exactly right. You know, I used to look at my HEDIS scores, and my HEDIS scores would move a couple of percentage, you know, in terms of retinal eye exams or something like that. And then I'm expected to pay incentives because, you know, they moved the HEDIS by 2 points, but that never affected my bottom line.
Yeah.
And so even though everyone says, well, that's better quality, whatever, but lifestyle medicine can improve the bottom line. When I've done lifestyle medicine programs, I can see the results oftentimes within months, because now the patient no longer needs that drug. And that drug claim is hitting my cost center every month.
Yeah.
And I can immediately see how lifestyle medicine has impacted that. You know, the HEDIS stuff is fine. Yeah, do that too, but I'm not going to see it in my bottom line. Therefore, I don't have the same kind of incentive to pay for it. And by the way, everybody else out there that has a PPO or HMO, they're moving the HEDIS numbers too. So why should I give any more credit to lifestyle medicine? It's no different in my mind, if that's the way I'm thinking about it.
Yeah, exactly. And with this addition of looking at a total healthy lifestyle and really paying attention to the behavior change, the emotional and mental health that can be improved in a number of ways, and positive psychology is an important tool. I see that some employers even have like a chief happiness officer, putting that front and center. But when we talk about happiness, we're also talking about all the pillars of a healthy lifestyle, because the science is showing, right, that eating that plant-based diet, being physically active, getting enough sleep, all affects our mood and our mental emotional health. But so does these other pieces, the social connection and other gratitude practice, our spiritual inclinations, and where we find meaning and life purpose. And a lot of times that doesn't get a lot of attention, and a lot of times that actually needs to come first in order for the other pieces to go into place, to fall into place. So I love seeing those chief happiness officers, and hopefully we can disseminate that idea around the country and the world.
That's great. And, you know, it also just reminds me we've come a long way, because I remember sitting in a meeting several years ago, someone brought up the idea of a chief happiness officer, and the guy across from the desk from me says, oh, you mean the guy that shows up in a clown suit with the horn and tells a few jokes. And we've come a long ways, and now they're getting some respect, as they deserve. Yeah.
Yes.
Yeah. He showed a big picture of Bozo the clown, you know. The hair and everything.
Well, you've described a perfect vision of the future of healthcare and where we are working to in the direction we're working towards. But of course, the reality now is that things are still piecemeal for a lot of practitioners. And we have health professionals and practitioners who are listening to this podcast. So what advice do you have for them in the meantime, if they're not in that ideal practice setting? How do they pull this together?
Well, I mean, we have to work where we find ourselves. And each of us is probably in a little bit of a different environment. If you're working for a health system that has lives at risk, where they're contracted as such, that's a different opportunity than if you're totally independent and you don't have the kind of leverage or influence to change models. Or you could be in a policy position and you really, and that's sort of where I see myself more and more these days, is really changing policies and benefit design to enable physicians that are actually in the trenches to do these things better and more effectively. So it just depends on where you are, and you have to make the changes where you see them and where you can be most influential. I would say keep on fighting the fight, and but also continue to be a member of organizations such as yours, organizations such as ACLM, where together we are more united and stronger in moving the needle on some of these things. You know, one of the things that has plagued us as a group is that sometimes I have the opportunity to take the floor and talk to large employers about doing more with lifestyle medicine. And it comes back to, well, that's just a little cottage industry. You guys are not organized in a way that a lot of large medical groups are. And we want to contract with a group that can actually give us, you know, the scale that we need for our employees. And that's a real concern. You know, when I was doing this for Cummins, we had 55,000 employees. And if I roll out a benefit, I want to make sure that all 55,000 employees get this or have access to it. If I do this for, you know, 1,000 people in Indiana and my folks in Montana and California don't get it, they're not going to feel very good about it. So what it may mean is I don't get to do it for the folks in Indiana either. And so I think we have to look at ways to kind of bring ourselves together to say we do have a united front and this is how we can work together and deliver, which then means we have to have some operations in place. We have to have, you know, some standards that we hold each other accountable for. So those are some of the infrastructure things that we'll also need to think about. And so wherever we are, start thinking about those kinds of things.
Yeah. Well, clearly being champions and advocates and influencers, because we're the early thought leaders and early role models and examples within the lifestyle medicine community, positive health community, is spot on what can propel us forward, inspire us, and I love that. I'd love to bring it back to more of a discussion to a personal level in that what do you do for your own happiness and health? Or what's your favorite happiness and positive psychology strategy?
Well, I think you know that about 5 years ago, a little over 5 years ago now, my wife and I, we moved to the country. And so we live in the mountains of Oregon and there's clouds out there right now and some fog. And, I just love being out in nature. I love doing things with my tractor and getting my hands dirty. And so for me, that's positive. I love breathing the clean air and interacting with the animals on my property, some of which, you know, eat all my vegetables, but that's good. That's fine. They deserve some of that too. You know, chopping wood, I can heat my house with firewood. So, you know, I have my chores. And but it's physical activity, it's sunshine, it's being, you know, out in nature. There's also that sense of accomplishment, because when I cut that tree and split the wood, I can pile it up and I can look at it and say, that's what I did, right? And I'm heating my house and my utility bill is zero, even in the dead of winter. So it's those kinds of things that I do, and it just makes me feel good and it's positive.
Well, certainly nature and being physically active, those are two components there. And then having that a little bit of sense of meaning that you're adding to your home and your value system. Yep, those are all pieces of positive psychology. So that's sounds spot on. So as we're wrapping up this talk, I have a couple of more questions for you. One is, what are some resources that you recommend to our listeners? What are some of your favorite books or websites, articles, anything that pops up that you think people really need to know about?
Well, you used a word earlier. Maybe it was before we started the recording, but I know initially today we talked about the whole idea of holistic approach to care. And so I think that the more that we can really understand that, the better. And so I would suggest that people continue to look into those areas. And I know a lot of your listeners already do those kinds of things. And then the other thing I would say is, let's continue the conversation among each other. I find the greatest value in having conversations like this I learn things. I always learn things from my colleagues. And then I find ways to incorporate that into whatever I'm doing. So I would say, let's continue to do that. We are at that inflection point where we will start getting reimbursement for some of these things. And we need all of our best minds at the table to get it right. The other thing too is once you start to get paid for something, you're going to have a lot of wannabes that are going to try to tag on, steal our message, and it probably take it in the wrong direction. But so we need to guard for that as well. But together we can keep our eyes on ears open, watch each other's backs, and be successful together.
Yes, I love that. And I've certainly thank you, Dexter, because you and I have been colleagues for many years doing exactly that, having conversations and watching out for each other. So I appreciate that. And thank you again for joining this podcast. Any last words?
Keep up the good work, Liana. You're so valuable to the movement. Thank you.
Thank you so much, Dexter Shurney. And thank you to our listeners for the Global Positive Health Institute podcast.